Well, today we're here at Pascagoula in the surgery area with Dr. Witterschein. He's one of our great orthopedic surgeons. Lee, what is some of the technology that we have here that Dr. Witterschein is so great at giving?
Well, we've got about every kind of robot that you can imagine these guys like working on. Why don't you tell us about one of them, like the Mako? Tell us a little bit about the types of surgeries you use that for to assist you in great outcomes.
Sure. So I use a Mako robot for total hip and total knee replacement. And frankly, it is just advanced the way that we do things. Outcomes are improved. Speed and efficiency in surgery is better, more accurate cuts. And it's been a game changer for me in the way I do surgery.
So you don't actually, the robot, that you do the surgery, the robot assists you. Can you clarify that? Explain a little bit. How does the robot assist you in your precision and accuracy?
Well, what we do is we get a CT scan of the patient's knee, and then that gets loaded into the robot, so the robot knows where the knee is. Then by taking points, we actually just use a robotic arm, and the arm I actually drive, so there is human control. But what it does is it just eliminates error and increases the precision of the cuts. So whenever we make these cuts, we know exactly where they're going to be. At the same time, it also allows us to balance the knee before we make the cuts.
Okay.
So typically, we just get one shot and the knee is perfect first time. And once again, speed, efficiency, and outcome.
It also, I guess, reduces the invasiveness, helps people get back to life quicker, too, with the assistance of the robot, correct?
Faster recovery, and which is part of the whole rapid recovery protocol that we started here 5-6 years ago now.
So what about total hip surgeries? I know every once in a while, people fall, or we're all getting old and grinding down on those joints. Talk about how you improve people's lives by giving them replacements.
Oh well. I mean, you improve people's lives if they're disabled, if they're crippled, they can't walk. Hip replacement will save their life. And then you kind of alluded to fractures. Once again, the style of surgery that we do, minimally invasive, well, that means once again faster recovery. So we can take these people and quickly get them optimized surgery, replace the hip, and get them up and walking on it within 24 hours, which is typically our goal. And then that eliminates complications, long-term issues such as pneumonia, and other things.
We're here with Dr. Bailey. He's been a long-time surgeon of 25 years here at the system. He's a member of South Mississippi Surgeon and also is a breast specialist. Tell us a little bit about why you're so passionate about helping women overcome cancer.
Well, it's such a common cancer. We all know somebody who's been affected by breast cancer. About 1 in 8 women will be affected with breast cancer in this country. And so it's one of those things that we have been very good at doing and taking care of here at Singing River System. It's one of those cancers that truly requires multidisciplinary work. So we depend on the radiologists, primary care physicians, the gynecologists to find these cancers or find things that could be cancer. And then we have a good team at the Cancer Center with medical oncology and radiation oncology that provide everything that is needed to hopefully help cure these patients with that problem. Here in the OR, for example, we have a very well-trained team that we work with pre-op, intra-op, post-op, and then the floor nurses that help the patients that spend the night with us before they go home the next day to help train those patients and their families how to take care of things, what to expect.
Wonderful. And we also have a tumor board here that I know that you're a part of. Talk about the collaboration that you said with the Cancer Center, with the radiology.
So our tumor board meets once a week. We discuss our patients. We have pathology, radiology, medical oncology, radiation oncology, and then me representing surgery there to provide all of the input for the various aspects for each patient to try and provide what we think is the best plan for them.
Right.
I've been to some of those, and I'll tell you, it makes me really proud to be part of the system and see all those specialties come together for the good of the patient. It's just really a inspiring process. One of the best tumor boards in the region.
Right.
So I appreciate
Thank you very much.
that. But it really is good for the patient. I mean, it's,
Oh, yeah.
Personalized care, individual treatment plans depending on the person, not just the disease.
Exactly.
What do you see behind the scenes that helps, you think, leads to us getting that A? What's so good about what happens behind those doors?
Due diligence by the employees and following policy and making sure that our sterile technique is always on point. And we all work together with one another to make sure that all that stays in place.
We're here with Dr. Jeremy Simpler. He is a general surgeon, medical director for our wound care center in Ocean Springs, and also has just been named a Surgeon of Excellence along with our Center of Excellence designation for the health system in robotic surgery. So Dr. Simpler, tell us a little bit about how we were able to achieve this prestigious designation.
So, really, our group in the hospital system, went above and beyond to put together, data and information to submit to the this review system to show that we're achieving good outcomes with robotic surgery, and that we have the case volumes and the case types to warrant this designation, which is a really impressive achievement for our system, to just show that we're keeping patient outcomes and patient how well we're doing these operations, how well our patients are doing at the forefront of the services we provide here. So.
Absolutely. So we're the only center of excellence in robotic surgery from Jacksonville to Houston, and because of the great work of our team and our surgeons here. Talk about some of the procedures that you use with the robot. You use the Da Vinci, correct?
Sure, yes. We do the Da Vinci surgical system. What we do, from my standpoint, is we do robotic hernia repairs, robotic colon resections, cholecystectomies, and what that allows us to do is to do increasingly complicated procedures with smaller incisions, getting patients home faster and less time in the hospital.
Pascagoula of our OR team, and this is one of our great orthopedic surgeons, Dr. Harrison. Tell us a little bit about both of you, if you would. Tell us a little bit about what makes this system so great for you and the patients that you serve. Tell us a little bit about that.
Well, I've been with Single River Health System since probably like 1990, for a long time, for a very long time, and I couldn't see myself ever working for any other organizations.
Why is that? Why do you love it here?
The biggest thing is just like a big family. It is, and I know people say it from other places, but I know that there's nothing that any of this team, from administration to our own department to affiliate departments, that if there's ever a need, we pull together. And I've seen it like over and over again when either someone's child has an illness or there's an emergency. It's nothing like taking care of people in our community that most of the time or it's somebody's sister, brother, grandmother.
The investment, it makes you feel like you're a part of something bigger than yourself and you get to take care of the ones that you love.
Yeah.
Absolutely.
What about you, Dr. Harrison? Why do you like working here?
Yeah, I joined in 2006 from Bienville and started working at Single River. The orthopedics has always been a big part of Single River, but we just kept developing, our total joints. With me doing total shoulders and total knees, and then with Washington and his total knees and hips and Wittersheim, our success and our surgical staff here, I would compete against anywhere in the country as far as our nursing staff, our surgical techs. And I think it's because, like Shannon said, we're a family, we're a team, and I think our quality of care can't compete.
Not only would I agree with that, Leapfrog did too. There's not many A-rated systems in the country, and this is one of them. So I would agree with you. I think that's spot on. So
I mean, I think as we say at Bienville, we're the one to trust. I think that's a good slogan. You can trust that you can get quality orthopedic care with us, and we're going to provide the best service. And if we're not the right ones, we're going to get you to the right person.
Right, the collaboration between you and your colleagues and the other surgeons here, from the cancer center to radiology to the urologist to everybody.
Traumas, y'all all work together.
Yep, 100%.
Very uncommon. Well, thanks so much. We appreciate it.
Yeah.